It's ABBA, the supergroup from Sweden, the song called I Have a Dream. And the dream is, if not a cancer-free world, possibly a world with more cancer cures? I don't know. Good morning, Dr. Cathy Walton. How are you doing?
Morning. I'm very, very well, thank you.
Thanks for popping in on a Sunday morning because all doctors work very hard. I imagine that you don't have as much of an after-hours schedule as an average GP, I'm guessing.
You're guessing right.
Okay.
You don't work so hard.
Well, probably just as hard, just not the weird hours anyway.
Not the weird hours, yes.
Exactly. So my first question to most guests is, what are you normally doing at 8:15 on a Sunday morning?
Normally, I'm either sleeping, going to the hospital, or going to church.
Right, because it's one of those.
Yeah.
I already know how you like your coffee because we've got that part waxed. Was your coffee okay? Do I get the job?
It was absolutely delicious, but I do like full cream milk.
Not just you. What is this fake grey rubbish that they're serving us? And really, I'm going to take the 30 seconds and say, y'all do understand that 2% milk is a marketing triumph because full cream milk is only 3.3. You're saving 1.3%. Stop it. Anyway, back to the story of Dr. Cathy Walton. Where are you from?
I'm, not born, but I grew up in Port Elizabeth. I was born in George.
Yeah.
Grew up in Port Elizabeth. Went to school here and then studied in Bloemfontein.
Oh, what school? Because this can be quite telling.
Yes, I was at Clarendon Park Primary School.
Okay.
And then Victoria Park High School.
Right. So at any point during this time at school, did I always want to be a doctor? Did I always want to be a doctor?
Yes.
Or, really?
Since I was about 4 years old, I was telling everyone I was going to be a doctor.
Okay.
So at some stage, as all children do, I went through a stage where I was going to be a teacher, but I was going to be a lecturer in medicine. So it never varied away very much from the doctor side of things.
It must be comforting and not comforting to be that certain that early and to have it almost in your mind as something, as a future goal, and just work towards it, rather than that paralyzing, I seem to be good at either nothing or lots of things and I don't know what I'm going to do. Did you have all the right marks, all the right subjects, all the right stuff?
I had all the right marks. I had all the right subjects. I don't remember ever making a conscious decision about it. It was always just there. It was always, I never made a conscious decision, now I must work hard because this is my goal. It was always, that was part of me and that is where it was going to be. It was doors that were opened and direction that was given. So it was part of me from a very young age.
That kind of taps in quite neatly to my theory that I hate to say, let's go with careers. Careers like this are almost more of a calling than a choice. Not?
Absolutely. It shouldn't be, especially when you're looking at the specialist fields. But these type of careers should really be that your heart belongs there, not your brain and your mind. It mustn't be a decision. It must be a heart decision more than a
so subconscious.
I get the marks, so therefore I should become a doctor.
Yeah.
I have some friends who got brilliant marks and they went on to study medicine and got halfway through or in their 6th year, final year, and they thought, this is not what I want to do with the rest of my life. And I mean, that's awful. Because
that's a long way to go.
It's a long way to go, just because you had good marks in school.
Yeah. My parents would have loved for me to become a doctor. However, I've turned into that guy who went into the radio, Shim, and they're still hoping I'll get a real job. I don't hold out as much hope as they do. More about you, though. Okay, so now we're going to do this thing, and you went and studied in Free State, if I understand correctly.
In Bloemfontein, yes.
Okay.
Yes, yeah.
Any particular reason?
My dad was transferred to Bloemfontein in my matric year.
That'll do it.
I always wanted to go to Stellenbosch, and then he was transferred to Bloem, and it was, sorry, you're going to Bloem. And as things happen, it was the best thing that could have happened to me. I absolutely loved Bloem. Got a fantastic undergrad studies there. Loved it and learned a new culture, the Afrikaans culture, adopted it almost as my own. And then went on to do my internship in Pietermaritzburg at Edendale Hospital and my community service in Queenstown.
I see that, where I was born. That was very interesting. You worked in the hospital I was born in.
Oh, really? The Frontier Hospital.
So that must have been interesting because Queenstown is also in that kind of weird space of not quite city, possibly bigger than it town in our conventional kind of understanding of it. And what kind of work did you do in Queenstown? Because it looked like you worked in a couple positions.
I did 6 months of psychiatric work at Kumani Hospital first, and then I went across to Frontier Hospital. I did a lot of work in the emergency room, in the casualty there, under internal medicine, and then moved across to pediatrics. And then I did a lot of work in the neonatal ICU, which I absolutely loved. Always thought I would specialize in pediatrics. But working in pediatrics and working in the neonatal ICU, my heart just broke. And I thought there's no way I can do that for the rest of my life. So, yeah.
I did wonder at what point the decision was it's going to be oncology and then to specialize further as you have into radiation oncology. I've said the same. My heart is simply too small to handle stuff like that. That being said, in the normal course of events, for somebody who works with cancers, and particularly on a level that requires radiation, it must surely also come with its fair share of ups and downs.
Absolutely. One goes through amazing times with patients that are cured and sadder times where patients do die. But it's a journey. And it's knowing that you're part of that journey, and whether the journey ends, as you would say, positive with cure, or whether it ends with death, it's a journey, and it's about how you help the patient through that journey and the families through that journey. But one does go through an emotional topsy-turvy during the course of a day.
One of the questions that I posed to Dr. Neil Littleton, who's one of your colleagues, when he was in for the Sunday Sitdown a good few years ago, I basically said to him, why cancer? Why? And then he said to me, why not? And basically what he was saying is, it's almost as though it's a path that you walk with the people who are close to you, with your medical professionals, and it almost, if it does have not the desired outcome, which, as you say, as we know, is cure, there is an aspect though of wrapping things up of. I'm saying it's a horrible way to go. He's saying not necessarily.
Absolutely, not necessarily. I believe in when a patient is terminal, I believe that quality of life is the most important. And although we can still use radiation and chemotherapy at that time, it's all about quality. And it's about having that time where you can actually sort things out and spend that time and know, well, you know what, I'm not dead yet. I've still got life. I'm still living. And it's about what I've got over. So, it's an awful topic on a Sunday morning, but if one looks at a car crash,
it's
for
life,
example,
people.
Absolutely.
It's real life. It happens every day.
Absolutely.
And who has not been touched in one form or another by cancer?
Exactly. But it is one can always see a positive, try and see a positive to it. If one looks at sudden deaths or car crashes, which are so unexpected and almost more of a shock, one has time with cancer.
That was the point being made.
To make the decisions that you need to make about how you want to die as well.
Sure. So at what point do you decide that radiation oncology is the ultimate speciality for you?
Well, I actually specialize in both radiation and medical oncology, so I do both. I do the chemotherapy and radiation oncology. It was by default. I actually thought I was going to do more medical oncology, and Bloemfontein offers both specialities, so I did both specialities.
Overachiever, this one, eh?
All of the oncologists in Port Elizabeth are both medical and radiation oncology specialized. And yes, needless to say, I was never very good at physics at school and neither at varsity in my undergrad studies. And then radiation happened and it's all about physics.
This is a steep learning curve.
It was a very steep learning curve, and it's actually quite a big family joke that I'm not that technologically inclined, and yet I'm the one doing all the radiation. But yes, that's what happened. And radiation and medical oncology, the chemotherapy in combination, really can make a huge difference to patients. So that's why, and that's why I'm glad I did both.
Surely. Recently, you made the news for a pioneering gamma knife radiosurgery performed by remote. So let's talk about both the kind of nature of what it is that you were doing and the achievement that you were in Port Elizabeth, your patient was in Gauteng, and yet we did this thing. So let's talk about what it is that you were doing and then how you were doing it over that distance.
Okay, so the machine that delivers the radiation is in Johannesburg, and but we program that machine to deliver the radiation in a specific way. And basically the scans and the images are sent to me from Johannesburg as the patient is lying there. The images are sent to me. I then basically program the machine to deliver the radiation in a specific way based on the images at that time.
Right. And the aspect of doing it by remote, are you basically team viewing the procedure, or is it nowhere near as simple as that?
No, it's actually much simpler.
Oh, wow.
I'm just programming the machine and I press the enter button. The enter button sends the images and the plan of the radiation back to Johannesburg. They press the enter button there and the radiation is delivered over there.
Yeah, but gamma knife radiosurgery is obviously ever evolving and becoming ever more precise, and what you're able to do with it. So is this somewhere where you see your passion kind of being refined slightly further, or will you still be as broad-based as you have been?
I enjoy being broad-based. I have already narrowed my oncology spectrum quite drastically because it's such an advancing field. Oncology and cancer medicine is such an advancing field. So I already treat very limited cancers, but gamma knife radiosurgery is very brain-orientated, and I really enjoy treating brain tumors because of the challenge that it involves in trying to maintain as much normal brain function as possible. We do treat a lot of benign conditions with gamma knife radiosurgery. It is more complicated because you have to be more precise. So I do enjoy that as well, but it is hugely challenging. I do see myself going more into that, but I do enjoy the breast cancers, treating breast cancer patients, and the evolution of the management of breast cancer in particular and melanoma is absolutely fascinating.
Yeah, I see that you do still also have your fondness for pediatric kind of aspects as well.
Yes. I still do enjoy doing the pediatric radiation. Although the emotional side of treating children is taxing, I still love treating children. So I get that with the pediatric radiation that I do occasionally as well.
Right. Where to next?
Oh, who knows?
Okay.
I'll see what doors open up for me.
So the plan was, I'm going to be a doctor. From there, it's let's live it.
Yes, let's live it and see what happens and where we go and what doors open, and go through the open doors.
No, sold.
Take the challenge.
Yeah. Now, in the original brief that you received before you came in this morning, you will have been told to prepare for what is always the final question in the Sunday Sit-Down. So, Dr. Cathy Walton, if you were president for a day, you would... ...
Very difficult question. I sat and thought long and hard about this one, and I would actually pass a law that all matriculants, once they have finished matriculated, they should do 1 year of obligatory community service. Minimum wage being paid, and it can be in the field of their chosen field of study, but they should do 1 year of community service. Boys, girls, everybody should do 1 year of community service. Give back to their country, and give back to their community. And maybe not do so many gap years and actually get stuck in and work.
Yeah, but I mean, if you approach that cleverly, you could upskill yourself for a year while still contributing to the economy and earning at least some money, as opposed to the massive unemployment, particularly amongst the youth that we have.
Absolutely. And there is a wide range of areas that one can go into and do community service and get minimum wage, and there's a need for people who are willing to do basic jobs, and started with matriculants.
True story. Well, you have my vote.
Thank you.
Thank you so much for coming in. Enjoy the rest of Sunday.
Thank you very much. Thanks for having me.